The title is Easy Exposures, a toolkit of techniques for clinical use. But what we're really going to be emphasizing is how to incorporate values work into exposures within our therapeutic practices, um, as well as to try to maybe make exposure work feel less rigid. I imagine when someone says we're going to do exposure therapy, it brings up these connotations, it brings up these thoughts, it brings up these ideas of what that looks like. And at least I know for me that those can be pretty specific. And I want to untangle that a bit and really help y'all to highlight the informal ways you're already doing exposure with clients in the room, why that can be so transformative, and then how to improve outcomes by using values as a bolster for all of the scary things you encourage people to do. All right, so just a little, coverage of risks. Something to note that this program discusses strategies for utilizing exposure work in therapy, and all of the techniques discussed in this presentation are in accordance with APA ethics codes and relate to evidence-based treatment protocols. But I want to note that misapplication of the materials that I discussed today or errors in the materials could result in non-compliance with these codes. So just be aware of that. All right. Scary shit. I want you to take a second to get cozy in your chair or whatever it is that you're sitting. I can't really see any of y'all. I wish I could, but um, whatever spot you're in for this presentation, take a second to settle in. Maybe take a deep breath. Notice how your body feels. Notice the quality of your mind. Is it loud right now? Is it quiet? Is it fuzzy because it's early? However it is, just let it be that way. And I want you to imagine your life as a story or even a novel where you are the main character. Here's the important part. I want you to ask yourself, what kind of person do you want to be? If you were writing a story about yourself and you didn't have to bump up against your own discomfort, it was pure fantasy, what kind of person do you want to be? Now, since this is a professional event, I want you to think about your clients as well. Who do they want to be? Who are they trying so hard to be? What's getting in the way of them being that person? Now, here's the kicker. The moments that really shape that story, your story, their story, the moments that make us and our clients grow, those are almost always uncomfortable. They're risky, they're scary. Exposure. It's saying the hard thing, trying the thing you've been avoiding. It's stepping into uncertainty. Well, why? Why be willing to be uncomfortable? Because these moments are tied to what matters. They're tied to your values. Values like love, courage, growth. integrity, maybe adventure, qualities or experiences in life that light a fire within you, a real movement towards a meaningful and intentional life. So, right now, touching back in with yourself, with what's going on upstairs, in between your ears, ask yourself where in your life or in your work with your clients are the scary things pointing you toward meaning? Where are the scary things pointing you straight toward meaning? And what I want you to do is just keep that question in mind today. What risks are worth taking to become the person you want to become the therapist you want to be, and to help your clients become theirs? So, a little introduction about me. I'm not going to go into this too much because this stuff is available on our bio on the website. But I got my PhD in clinical and counseling psychology from Utah State University, in a town in northern Utah called Logan. Lovely experience. And I mention that because of the combined nature of my training. I think that this ability or this exposure to clinical psychology and counseling psychology in such an intimate way, both in research and clinical practice, has set me up to understand how to informalize exposure so it is more simple. It's recognized as a natural part of the healing work we do as therapists, and maybe it's not so rigid. Maybe it's a bit more um, fun and natural, and highlighted as a key piece of all the work that at least I do. So some of the learning objectives that we're going to cover today, exposure work and why it matters. We're going to explore multiple exposure techniques, um, having exercises for each one. Hopefully that involves a bit of a participation component. I know there are lots of things that when you're working from home or you're in your office or you're attending this event virtually, that our attention will be pulled towards. And I'm not going to sit here and say that, I wouldn't engage in those things either if I were in this webinar. But I do ask that when we do the exercises, try to be present at least with those. Try, if you are multitasking, to put down whatever else it is that you're doing and be present with that. Because my hope is that you get something meaningful from that. But I won't hate on the multitasking, let's be real. Um, Another piece of what we're going to do today is, as I said before, we're going to engage in some of these techniques in informal ways so that you can see what they look like in action. You can get some practice with them, and then you can start to think about ways in which you might be able to incorporate these seamlessly, or at least more seamlessly, with your clients. And with each technique that we do, we are going to involve how do we have values-based discussions around um, exposures. What makes the juice worth the squeeze? And I just want to kind of recognize my bias. So I am primarily an ACT aligned therapist. I kind of venture out into other areas when it's needed and the evidence points me in that direction. But ACT is my home base as a therapist. And so the way that I talk about approaching discomfort is going to be through an ACT lens. And I don't want that to limit our discussion today. If your theoretical orientation bumps up against that, you know, think about it through your own lens. Think about how these techniques can easily be applied through your own lens. And my hope is that with what I've presented and will be presenting throughout the presentation, that won't be hard to do. Um, and then as a part of the exercises, we're also going to discuss a little bit about which disorders fit best with each technique and go into a little bit about why. And then we're also going to address some misconceptions and hesitations that clinicians might bump up against. All right, I'm going to check in with the chat real quick, see if we have anything there. Okay. And then, like I said, with the Q&A, I will come to those at certain points throughout the presentation. So if you're putting questions in there, we'll just let them pile up and we'll have a little bit of a run through at some point of those. But we might bump into some technological difficulties on that end because I've never used that before. So just bear with me. Okay. So now getting into the technical stuff, why exposure therapy matters. Um, so exposure, especially in combination with cognitive behavioral therapy, is a first-line treatment for anxiety disorders, obsessive compulsive disorders, somatic complaints, and can also be an important healing mechanism for trauma and depression. It is a big part of our work as evidence-based therapists. And in my view, if it is not a big part of the work and you are working with folks with these different struggles, I think it should be. And my hope today is not to, impress upon you that rigidity. It's more to highlight, oh, I am doing exposure work and I'm not even maybe as aware of it as I thought. Or to identify places where you might bolster your game and add in more work that is evidence-based and aligned with moving clients behaviorally in the direction that they would like to go in life. Um, One thing I want to discuss is the mechanism behind exposure. So I don't know about y'all's training, but early on when I was learning about psychology, the big focus was habituation. That essentially, the goal was focus on decreasing the fear by exposing the client to some stimulus, and that by doing that enough, the fear decreases and then the avoidance goes down. Over time, we've learned that that may not be the most important thing, and that is going to be a big piece of the work we do today, both directly and indirectly. You'll see it in how the exposures are discussed. But the other piece is this idea called inhibitory learning, and I'm going to refer to it more as kind of behavioral flexibility. But when we talk about general mechanisms within exposure, we're talking about this process of repeatedly confronting feared stimuli without avoidance, without compulsive behavior. And through habituation, the goal is to reduce the conditioned fear response over time. From an inhibitory learning model, it's more about weakening maladaptive fear associations, or maybe even more importantly, strengthening your own internal bravery. Teaching the brain that the feared outcome is unlikely or manageable, and that just because distress or discomfort is present with me does not mean that I have to pull back from this thing. especially if it is intimately connected with my values, with what's important to me in life. Anxiety will naturally rise and fall during exposure. That is something to notice through whatever technique it is you're doing, or whatever mechanism it is you're leveraging. But it's important to note that when we focus on behavioral flexibility rather than simply habituation, we're going to outlast the habituation response. New learning is going to be the thing that we leverage more so that exposure becomes kind of a way of life. That I can do hard things, I can do very uncomfortable things, and it's meaningful. Essentially, that even when distress is present, I can do things that are scary or bring up intense discomfort because doing so will move me in the direction in life that I really want to go. And I don't need to make the discomfort go away in order to start living my life like this. So I just want to hit on the maybe a more simple distinction between habituation and inhibitory learning. Again, they are not the same. Habituation focuses on fear decreasing by encountering some stimulus again and again, and that fear response going down. Inhibitory learning focuses on strengthening new non-threat associations so that fear can return, but is less likely to control behavior. And that's the big piece of it. It doesn't matter if the anxiety is high or low, the individual learns that I can still do what is important to me in life. All right, continuing with the nitty-gritty stuff. I want to go through some of these different disorders and talk about, well, I should say, I don't have a big research background, but PhD journeys require you to do quite a bit of that. And all of the research that I engaged with that I loved the most was about mechanisms of change. So why something works is really interesting and important to me. And I want to take some time here to highlight what we know the evidence says about why exposure might work for some of these different disorders, to give you a better sense, if you don't already have it, of why you're doing what you're doing, and maybe motivate you to lean into it even more heavily if you're not already. So everyone knows for anxiety and OCD, exposure is a thing. So why are we doing exposure for those? Well, the idea is that if we confront some feared stimuli or thoughts we have, especially in the OCD realm, without avoidance, without compulsive behavior, that we decrease the fear response and or increase our behavioral flexibility so that we can live life on our own terms, even when distress is present. The outcomes we're looking for, maybe a reduction in anxiety, wouldn't that be great? Sometimes it doesn't happen. A weakening of fear associations and improvements in distress tolerance or even willingness. For trauma and PTSD, often the exposure work involves activating traumatic memories in a very safe environment, which leads to some form of emotional processing, especially of emotions that have been suppressed, maybe extinction, hopefully some sort of cognitive reappraisal, some sort of, I can I can re-experience some of the feelings associated with this incredibly difficult moment in my life, and I am not unsafe in having that experience. And the hope is that this updates our fear network and reduces hyperarousal, avoidance, and intrusions, and hopefully some reduction in any behaviors that might be hypervigilant in a way that are non-values aligned. Gonna need some water. when you're talking this much without breaks. For depression, the big thing is BA or behavioral activation. And the way that I approach that from an ACT perspective is find ways to get your client to engage in life with things that they enjoy, things that are meaningful, regardless of how they feel. You know, how they feel is not the driver. It's not the motivator. Values are the motivator. Doing the thing is the win. And whether you experience depression during that activity or not becomes something you care about less and less. And hopefully, over time, what this does is it increases reward exposure. It has the potential to reduce anhedonia. Hopefully, it improves mood. Maybe I have here improves motivation, but maybe it changes our relationship with motivation so that motivation becomes something different than it was before. It doesn't require some feeling, it becomes based in action. But most certainly, it will hopefully increase values aligned behavior even in the presence of depressive symptoms. From an ACT-based perspective, from the way that I carry out therapy, that's the biggest hope. And then last one here that we're going to discuss, maybe more of a niche one, but one that's near and dear to my heart, somatic symptom disorder. Um, One of the primary mechanisms there is this exposure to physical sensations that elicit fear in an individual and also motivate dysfunction, have them avoiding activities or experiences that might bring up that physical sensation. Um, but by doing interoceptive exposure, which if you're not familiar with, we're going to talk about it a little bit later, we can break up that unhealthy cycle. The hope, no, the outcome hope there with somatic symptom disorder would be to reduce symptom-related anxiety and hypervigilance and improve functional engagement. Okay. I'm going to take a second to check in with the chat. And then I'm also going to, chat looks good. I'm also going to take a little pause, a little breathing pause for me and see how I might go about pulling up the Q&A. Here's the Q&A here. Okay. Well, I want to motivate y'all. I know, I can't see you. I'm gonna say that again. I don't see who's here, but I'm hopeful some folks are here with me. And toss some questions into the chat or the Q&A, and we'll come back around to both of those things in about 15 minutes. But I think it can really add to the quality of this. So please don't be bashful. All right. All right, we're going to move now into um, what I guess is the newest piece of any discussion around exposure with folks in this presentation. I think one of the thoughts that showed up for me when I was creating this talk was how do I not be redundant when I talk to a bunch of experts about exposure? How do I approach this from some new perspective? And I knew that I wanted to involve values, but because I practice so much ACT with clients, I think values just become something I do rather than something I think might be any different than how other people engage with therapy. So that wasn't initially highlighted to me as as the new angle. But maybe here it will be for y'all. And if it's not a new angle, maybe some of the exercises we do will give you some cool ideas for how to more intimately involve values into exposures. And here's some of the evidence why that might be helpful. So, the hope in involving values into exposures is that with exposure, we're trying to promote psychological flexibility and valued action. And if we can combine values and exposures, we get this tandem experience where clients improve their ability to live meaningful lives even in the presence of distress. And at least for me, with the clients I work with, if distress was something that just naturally dropped smoothly over the course of therapy and stayed there, and there was an evidence-based approach that made that highly likely, I wouldn't do any of this stuff, to be quite honest with you. I wouldn't do any of the psychological flexibility stuff, meaning willingness, acceptance, making space for discomfort. Why would we do that work? If we knew a way to drop discomfort and it was reliable and lasting and they were still engaging with their lives in meaningful ways, I think if we were all honest with ourselves, we'd just do that. But we have enough research to indicate that distress is more like this. It comes back. It shows up in new ways. It, sneaks around and gets you when, when you're not looking. It changes. A client shows up with one disorder. 3 years later, they show up with another one. This is what it means to be human. And so for me, what seems to be most interesting is this idea. How do we improve our clients' ability to live meaningful lives even in the presence of distress? And that's interesting on a personal level as well, being another human. And one thing that's interesting for values work, and by that I mean the evidence base we have around values work in therapy, is that there's some evidence to suggest that values-based exposure actually improves engagement and distress tolerance when it is a part of exposure therapy. Um, for instance, with acceptance and commitment therapy, in tandem with exposure and response prevention, which is a gold standard for OCD, where we're motivating clients to include exposures directly tied to values, we see results similar or better than if there are no values component. And one thing that's clear is that even if the outcomes we're looking at around subjective distress are the same, we still see significant increases in values living. And again, as that point I'm making being human, distress being quite up and down, transient, sneaky, increases in value living are incredibly meaningful, in my opinion. Um, One thing to note too is when you're doing this work out in the real world, even let's say you're building a fear hierarchy, or when you're working with kids, a fear ladder. Even if the exposures are similar to the way that they would be had you not done some sort of values work with your client, taking time to discuss what makes the juice worth the squeeze? Like what would be important or meaningful by you doing this really scary thing can improve motivation, willingness, and engagement. And I don't know about y'all, but when you just mention exposure work in therapy, clients clam up. I had a colleague yesterday in a consultation meeting say that they say something along the lines of, when we do this exercise, there's going to be a point when you want to fire me. And I thought that was hilarious. Like this is uncomfortable. I've seen people put on therapy screeners where they're reaching out for new therapists, unwilling to do exposure work. Um, yeah, this is uncomfortable. So if there is a way to improve the motivation, increase willingness, and increase engagement while doing this very evidence-based approach that we know has a strong base for effectiveness, then why not? So, um, here's some guidelines for including values and exposures, just a little bullet point list of things to focus on, especially if values work in a direct way is newer for you. Um, One thing, big thing, clarify clients' core values early. I tried to model that a little bit in this presentation with that scary shit thought exercise we did at the beginning. Um, and I don't want to talk about here's a worksheet, there's another worksheet. I don't want to make this rigid or formal, but take time, take sessions to discuss values with your clients and work through the surface level stuff, work through the shoulds that are influencing values, work through the pressures and the obligations that are influencing values, and wade through all of that to get the best sense you can of what is important to your client, not just for you and maybe least importantly for you, most importantly for them. And then have this bank of values you're working with to support all the work after that so that you can continue the motivational interviewing that we know can be so helpful throughout the whole course of therapy, getting them more willing to take behavioral risks and move towards what's important, all supported by their own, fuel. It helps. Um, Next piece would be connecting exposure tasks to valued actions. We've already discussed that a little bit. A big one from at least an ACT-based perspective, maybe less important in other theoretical orientations, but spend a lot more time tracking valued actions, reinforcing values-based behavior, and a lot less time with anxiety ratings. If anything, give them more props for doing something meaningful to them when anxiety was through the roof than focusing on, oh, do these exposures over time add up to you feeling less anxiety? And that can really start to, in a helpful way, undermine this internal control focus. This idea that when distress is high, I'm not okay. When distress is high, there's something wrong with me that needs to be fixed. Um, I can shift that relationship in a way that I find to be pretty meaningful. Again, a little disclaimer, I'm an ACT therapist, so of course I'm going to say that silly kind of thing. You do it your way, but I just want to present why I think that focusing on values more than how high the distress is can be a new idea to try with your clients, especially if you're noticing hesitancy or them or you feeling stuck. Along those same lines, frame exposure as do what matters, even with discomfort. Most theoretical orientations don't have you doing exposure while trying to calm yourself down the whole time. So it really is a practice of distress intolerance strength training or willingness strength training. So to leverage that and then only track or only reinforce decreases in anxiety or subjective distress just wouldn't be in alignment with exposure at its heart, regardless of the theoretical orientation you're coming from. So just something to be aware of, something to think about if you haven't already. When you debrief with clients, as you usually do as part of exposure work, make sure you're highlighting movement toward values. And if you're doing this in a values-based way, maybe that's the most important aspect to debrief. You did the thing, you did this meaningful thing. How does this connect to your values? You did it even in the presence of distress. How cool is that? Um, Yeah, I wanted to use this slide to have a fun habituation conversation, and I'm noticing this urge to be pulled away from that with uh, navigating the chat, but I don't want to. So we're going to slow down a bit here. I want to go through some of these points, and then I want to discuss habituation um, more generally. But some common myths about exposure. Exposure is unsafe. Well, not true. Properly guided, it's safe, and it's certainly evidence-based. And there's quite a bit of evidence out there. Let's say for work with kids, especially in that like in 7 to 15 age range, that maybe exposure is the most effective thing we can do for certain disorders. So it's certainly evidence-based, and in um, a variety of psychopathological presentations, it might be one of the things that we can do that's going to give us the most bang for our buck. So if folks are showing up with these issues and we're not doing it, that then we might not be serving them as fully as we could. Another myth about exposure is that clients won't do it. Maybe I'm challenging that myth with some of the things I discussed earlier. There is certainly hesitancy. Exposure involves directly contacting discomfort. Why wouldn't there be? This word avoidance often bugs me. It feels very blamey, for lack of a more scientific term. I think there's good evolutionary evidence, research out there to suggest that humans are hardwired to avoid, that there are many reasons why seeking safety and comfort over time, especially when less safety and comfort was available to us, actually did keep us safe. So in that way, it makes sense. And I think this is an important thing to note with clients when you're doing exposure work as well, is like normalize that urge to avoid. Maybe even change the name around avoidance, or focus less on that word and focus more on this idea of moving towards. Not beating them up for avoiding, not using a word that is another whip they can slash across their back, but by reinforcing all the ways that they counteract that natural human tendency. And that's one of the reasons why values work, I think, feels so meaningful to me, is that it highlights this in a more positive way. It increases motivation to do these uncomfortable things, without the need for saying, "Hey, stop avoiding stuff." Well, it's not that simple. My brain is telling me that this thing is dangerous or uncomfortable, and as a human, I'm going to be urged to listen to it. How can we break up that unhelpful relationship? So values framing increases buy-in, and hopefully we can work with that. Another common myth is that exposure is only for OCD or phobias, and that's not true. It works across many disorders, and we are going to see just why when we get into the exercises. Okay, so the habituation conversation I mentioned. Um, Yeah. Um, I think, that when you're in these environments, you hesitate to give personal examples, but personal examples can be so helpful. So, the distinction between habituation and, let's say, psychological flexibility is an important one for me in my life. I have a partner who has a chronic medical condition and one that we've been dealing with for many years. And one thing that has always been a tricky aspect for me is this. I wouldn't call it moderate, maybe low to moderate fear of medical environments, of medical procedures, of blood draws, all of going to the doctor, all of those things involved pretty high levels of anxiety for me. And most of the time I still engaged with them, but if I'm honest with myself, I probably engaged with them less than someone who didn't have that fear. And then, my partner gets sick. And now we have, over the course of the last several years, attended hundreds of medical appointments, literally. Watched her engage in hundreds of medical tests and hundreds of blood draws. I've been in this environment that scares the shit out of me hundreds of times with her. And I'll tell you now, this is just an anecdote, my own personal experience, and we want to keep this based in evidence. So we'll just be this strong disclaimer. I'm just talking about my personal experience. If habituation worked, I wouldn't be scared of any of this stuff anymore. I mean, I am there, I am in it. I am present with her, I am present with the distress, and by now, I wouldn't be scared of these things. And in fact, I would say um, maybe my neuroticism has maybe even increased. Maybe some of the discomfort and distress I feel in those moments over time has maybe even increased. What has also increased, though, is my ability to be present in those moments, to be loving and attentive in those moments. But I know that if I had relied on habituation, I would have been screwed. Instead, I needed to, well, for lack of a better term, become more brave, more accepting of discomfort, to find ways to make space for it because being present and attentive and loving with her are some of my deepest values. And that's what makes the juice worth the squeeze. That's why, tomorrow when we go to another medical appointment, or next week when we go to another one, or the day after that when, I'm watching them poke and prod her again, I'm not going to run from that discomfort because by choosing to let it be there, I also get to contact her. I get to be with her. I get to connect with this person that is so incredibly important to me. And that's what makes the juice worth the squeeze. And that's the idea behind behavioral flexibility, that if it's not about decreasing fear, it's more about getting cool with fear. What can't I do? I can do a lot more. And that sort of emphasis with clients can really change the game. It can change the game personally. It can change the game professionally. So again, the habituation conversation, I want to take a second here, give y'all, a minute to put some things in the chat. My question is, are you having any new ideas around habituation? Are you thinking about exposure work differently? What conflicts are you having? Oh no, like the way that you're approaching this is different than mine, and I don't love it. And love to hear that too. And maybe, if some show up, I'm not going to put pressure on folks to engage if they don't want to engage, but if some show up, we'll cover, two or three. So just take 30 seconds now to add those in to the chat or the Q&A, and I'll shift towards those. All right, I'm going to start answering some of the questions that I see in the chat. Um, First one here, what is your preferred method of tracking values-based action? Are you doing this mainly as the clinician in sessions, or are you having the client track that on their own via journal or behavioral log? Uh, I love that question. I think what it highlights for me is um, that I tend to have a bit of a more informal approach to therapy. So I don't have, a worksheet or a log of, in the general sense that you would think of one. What I do keep with me is, like I said, this bank of clients' core values as part of their notes and case conceptualization, and talk about within my own notes and how I'm conceptualizing how those are connecting towards some of the behavioral moves they're making in their own lives. Are we seeing engagement with those values? Are we seeing avoidance? Um, are we seeing movement towards some of these specific goals they've set for themselves about things that they want to do? And I want to kind of bookmark something here. There's something that I use when I'm asking my clients to come up with values-based exposures, or just really in my regular practice, regular weekly homework are usually exposures, and it's the 90% rule. We're going to discuss that a little bit later. I'm just throwing that out there now to get it stuck in your mind, and then we'll come back to it. Um, the next question, do you have methods for clarifying core values? Yes, and some of the best ones out there, you can find online for free, like the values card sort activity is a pretty good one. I think I've gotten to a place now where I like to have the conversation in a more organic way. I love talking about the shoulds, have tos, pressures, obligations that people undergo, and not in a way to like throw those out, because there's a lot of important values that are also pressures. It's more of an and than a but. But taking, as I said earlier, multiple sessions to just talk about values, just talk about, are you being the kind of person you want to be? What would you changing this behavior or doing things differently allow you to move towards? That is a quality that you highly value that you're not currently moving towards. So those are some of the conversations that I tend to have. I'm going to keep looking. Maybe I'll just look for one that lets me sound more intelligent. No, that doesn't. I'm going to look for two more. I really like this one. So I work the chat was, I work mostly with young people ages 6 through 15. This feels very respectful of developmental stages and meeting clients where they are. I agree 100%. I started my journey in psychology in school psychology, in an area of school psychology called school-based mental health, which is essentially training therapists to be in school, kind of like community-based therapists within a school setting, providing therapeutic services, even having long-term clients where you're seeing them for 8 to 12 sessions in a school environment. And how do you do this in ways that are evidence-based? Anyways, I've spent a lot of time working with kids, and I would agree completely. There's certainly a strengths-based component to it that resonates well with kids. Some of the kids that get sent your way, maybe they're not super bought into therapy. This is a way to get them jazzed about it. How do we talk about the things you care about? And then how do we build our exposures that might move you out of dysfunction around the stuff that's important to you? Okay, I'm going to check in with the Q&A. As the last one, this will be our fourth one. It is very interesting to add the value component to the exposure because now I can see the values as the motivation. Yeah, I love that. I mean, that is a very clear, concise way to discuss what we're talking about. I think something else that shows up for me too is don't like I mentioned, the values card sort activity or other activities you find that may clarify clients' values or identify clients' values. Don't let that be a one and done kind of thing. Values conversations just continue throughout the whole course of therapy. They continue to be more intimately highlighted as folks start to move towards discomfort. You're a human, you're going to learn more and more about who you are and what is important to you, the more life you live. And so don't just say, hey, these are the 4 to 5 values, I'm working with those. Let's go. Make values in your own way a regular part of every therapy conversation that you have. Cool. Well, thanks for the engagement, y'all. That was fun. I certainly like conversations better than just talking at y'all, but we're good. This is the context we're in. Okay, I'm going to click out of the Q&A and we're going to move back into the presentation. Pretty soon we're going to be doing some exposures ourselves, so stay tuned. All right. I won't spend much time on this one, but just some data around why clinicians hesitate to do exposure in therapy. There's a fear maybe of harming clients or increasing distress. Maybe there's a fear of rupture in the therapeutic relationship because you're really encouraging them to do something uncomfortable. Certainly. And maybe that's the thing that could be the most helpful. Maybe you haven't been well trained or received proper supervision around exposure work. My hope is that as you continue to engage with this presentation, that you really start to identify, oh, I've been exposed to this maybe more than I think. And I know more than I thought I did. And this isn't as rigid or intense as maybe I thought it was. A misunderstanding of the mechanisms behind exposure that can certainly cause client or clinicians to hesitate. Any practical barriers like time, resources, yeah, all of those things can be hesitation points. So I just want you to start to drop some of these things in the chat around these 3 questions. And we're not going to spend a lot of time on them, but just to get you thinking about the direction we're about to head and your experience with exposure in the past. So the first question is, what aspects of exposure work in therapy are musts for you if you do them? And I want to talk a little bit about my musts in a second, but I want to highlight the next 2 questions first. Other answers you could throw in the chat. What kinds of exposures do you use with your clients already? And then what are some of your likes, dislikes of exposure? You don't have to answer every question. You don't have to answer any of the questions. Um, just toss in there what really is sticking out to you. And then as you do that, I want to discuss some of my must-haves when I'm doing exposure work with my clients because it's going to set the stage for what's coming up. The first one for me is posture. And when I say posture, I mean, are you ready to be with the discomfort in a way where you're not tensing or knuckling your way through the experience? Can you ride the wave of discomfort, however long it's going to last, given the thing you're exposing yourself to? And if you can't, maybe more skills work is necessary, or maybe we need to drop it down to a more reasonable exposure for where you are now. Meet the client where they're at. One thing I want to talk about with posture is that knuckling your way through things can be unhelpful for a number of reasons. One of the big ones for me is that it can really develop a bad habit for your relationship with discomfort. When discomfort shows up, this is what I do with it. My experience in working with anxiety disorders is that I have just as many clients who do a lot of things that are meaningful to them in life and knuckle their way through as I do with folks who avoid, who withdraw. And both of those approaches can lead to significant dysfunction. So if we're going to do exposure, we want to do it in a helpful way, in a healing way, and we need to make sure we're meeting the client where they at, and we need to discuss posture. Can you be with the distress that is going to show up or may show up when you do this thing? Um, and along those lines, one question that I ask myself, and one thing that um, is probably the most important piece of why I like to do exposure work so often in therapy, is I don't think there's anything that works as well as exposure in bringing the main distress that is causing the dysfunction into the room with you and with the client. If you can bring that into the room, bring the thing that is really getting in the way of them being the person they want to be, of living a functional or meaningful life, and play with it and work with it, and in a way where the posture allows for healing, change is going to occur. All right, I'm going to check in with the chat real quick and see what has shown up. Yeah, cool. See some things popping up in the Q&A. Yo, I'm getting better at this. So many screens up at once. Can you see me? Can you not see me? Can you see my presentation? Can you not? So much going on in my head, but we're flowing a little better now. And I'm just taking a second because y'all don't know what I'm thinking to read through some of these responses and see if there's anything I want to highlight from it. Already some lovely ideas. All right, I'm gonna let the things in the Q&A sit there. Um, the stuff that I'm seeing in the chat, especially the piece about distress tolerance skills prior to exposure, absolutely. I think from an ACT-based perspective, is there enough psychological flexibility available, or has it been bolstered enough to start doing the exposure work really from that place of posture? Are they going to tense their way through this, or am I going to allow them to contact a new way of being with themselves that might change the game? So, absolutely. Okay. All right, so keep the Q&A ones piling up. Again, when we get to a good spot, I'm going to go through as much of those as I can. Mostly, I really appreciate the engagement. Hopefully, it makes it more engaging for you. It certainly makes it more fun for me. So we're going to keep moving in. Okay, another exercise, the beginning of lots of exercises. So the beginning of that point in the presentation when I said, if you've been on Instagram or answering emails or doing client notes or on ESPN or whatever it is that you tend to do when your mind's like, okay, I'm bored of this thing and I like this thing more. This thing is more valuable to me. Uh, um, yeah, just ask for a little bit of your attention now. Like, come back to us for a bit. And take a second to settle back into your body. Maybe take a deep breath, maybe do a little scan around your body and just get in touch with it. Really, we're just trying to slow down for a second. All right. I want you to picture a scene. And I want to say this might be a tough scene to picture, an emotional scene to picture, but just give it a shot. So the scene that I want you to picture is your own funeral. Your life has been lived. What does that picture look like to you? What does your own funeral look like to you? You know, see the room. Notice the light filtering through the windows, the quiet rustle of people moving, maybe the scent of flowers. Now start looking around the room. Who's there? Your family, friends, colleagues. Who's there that maybe you didn't expect to be there? And as we move into the part of your funeral where folks are speaking about you in your life, listen to the words they share as they speak. What moments do they celebrate? What qualities of yours do they remember most? I mean, this is your imagination, so maybe the most important part, what the hell do you want them to say about who you were? What do you want them to say about who you were? And as you're present with that, let yourself feel whatever emotions arise. Maybe pride or longing, maybe regret. Your life has been lived. Were you the person that you wanted to be? Did you do what you wanted to do? So, yeah, even if it's painful, hone in especially on regret. And as you're present with this internal potentially discomfort, don't try to change it. Just notice it. We're not going to do this for very long. Try to make some space for it. Whew. Yeah. Now I want you to imagine yourself letting go of fear, of pressure, of expectations, of obligations. This is a shift. Bear with me. Ask yourself, who do I really want to be if nothing else held me back, especially fear, especially discomfort? What kind of person matters most to me? How do I want to live so that if I were able to look back at my own funeral, I would feel satisfied? I would feel content, as though I had really lived meaningfully, as though I'd really lived on my terms intentionally. And let any thoughts that come up come naturally. Don't try to push them away. Just notice them. Now, I want you to take about a minute to write down four or five or three or two, quality over quantity, but write down some personal values that were elicited through this experience. Now, words or phrases that capture the essence of who you want to be and how you want to live your life. We've discussed some examples for these, but things like courage or presence, fearlessness, gentleness, spontaneity. It's helpful if these things aren't, if they're broad and open rather than very specific. So take some time to do that. All right. Well, you can continue refining those, identifying those, but we did that not to make you uncomfortable, but to highlight what it looks like to do a formal values exercise and then to let that information guide our exposure. So now we get to do some fun stuff. All right. So as I said, we're gonna do this stuff. We're gonna try it ourselves. I think that's more interesting. And we're gonna talk about some of the different exposure techniques while we do it so that it's educational. All right. So the first technique we're gonna discuss is maybe the one that folks are most familiar with, an in vivo exposure, which is essentially a real life exposure to a feared situation, to do the thing, to go do the thing that someone is scared of. The thing that springs most to mind for me is, specific phobias, but also quite helpful for social anxiety, or agoraphobia. It's a piece of PE or prolonged exposure, in tandem with imaginal exposure as well. It's kind of woven into the fabric of all exposure work to go do the thing directly that scares you and see what happens. And this often involves building some sort of hierarchy or fear ladder and then moving your way up this hierarchy or ladder. Approach, debrief. And often when we're involving values work in there, we're going to choose situations that are tied to meaningful activities. Okay, so we're going to do some stuff. So I want you to take a second and pull into your mind something that scares you. I mentioned, you're not sharing this with anyone. Maybe someone types it into the chat as I say that, but you certainly you don't have to. This can be very personal. I hope it is, because that would make it more meaningful. But pull into your mind something that scares you. The example I gave earlier about medical fear, something like that. This thing would be especially good if you thought that moving towards this scary thing would actually allow you to live more fully in touch with your values. So all the better if it meets that criteria. And since we're all staring at computer screens and we don't get to, go, well, I certainly don't have an elevator in my house, but if you don't get to go climb inside of an elevator, what I want you to do is take a second to pull up a picture on your computer, on your phone, of something that very directly reminds you of this scary thing. Maybe in the example that I gave, the personal example, I'd pull up a picture of, I don't know, a doctor giving a shot or someone getting an infusion at a medical center. This is as direct or in vivo as we can get in this experience, in this context, and we're going to do it that way. So note that when you're really doing an in vivo exposure, you're going to be doing the thing, but we're going to do our best here. And once you have that picture up, look at it, obviously. Give it a good look and notice what shows up for you internally. Again, posture. Are you like this? Can you be a little more like this? Can you release the tension and make space for the discomfort? And let whatever comes up as you look at this photo hang out with you for a bit. Maybe even like lean into it, lean towards it. You're safe. Stay with the experience. I want you to notice when discomfort arises, how are you interacting with it? What's your posture like? Now ask yourself, if I didn't avoid this thing that I'm scared of, how would my life be different? How would it be more meaningful? We're not really doing an in vivo exposure right now because the context doesn't allow us to, but I mean, what does this signal for you about something you could do soon? And that would expose you to this scary thing, but more importantly, would allow you to move even closer to something you really, really care about. All right. This one's gonna be a little goofy. I guess I won't know if y'all are doing it or not, but I really encourage you to do it. The interoceptive exposure. So this one really is well indicated for panic disorder. I'll talk a little bit about why maybe that becomes clear as we discuss more about what interoceptive exposure is like. But interoceptive exposure is essentially purposeful exposure to specific physical or physiological sensations in the body. And it works quite well for panic disorder, for health anxiety, for somatic symptom disorder, where those physiological or physical sensations are a key piece of this. One thing that I found interesting about this is like when we first started using exposure for panic disorder, we would often have folks go to the places that most often elicited panic. So I mentioned elevators earlier. That was a thing, maybe movie theaters, but they'd have folks go to these places where they would have panic attacks or be scared they'd have panic attacks, and that's where the exposure would occur. And the hope was that by doing that, habituation would happen, no panic. Yeah, that didn't really work very well because what they started to see is that they just had panic attacks in other places. Panic started showing up elsewhere. And what that led to was much more insight about the mechanisms involved in panic disorder, that it's not really the larger environmental context that is the problem or the thing where we need fear reduction around. It is the internal context that rather folks with panic have a fear of fear. And so when specific physical sensations show up for them, there's this fear that that means panic is going to show up. And then the cycle begins. And, panic's not allowed. Uh-oh, panic is coming. What does that mean? Might go crazy. Maybe it's more physiological. Maybe I'm going to die. It is the physical sensations that scare them much more than the elevator or the movie theater or the concert itself. And so if we can break up that relationship so that they are less scared of the physiological sensations themselves, we have a much better chance at um, meaningful change with panic. So, interoceptive exposure, we're going to do it. And I'm going to give you a few options. So, you can look some of these up online. This is well published out there what different interoceptive exposures are. One common one is to set a 45-second timer and then stand up out of your chair and run in place for 45 seconds. Obviously, the point of that is to get your heart rate up and beating fast. And for someone with panic disorder, maybe high heart rate or over attention on heart rate is one of the things that leads towards panic. And then by exposing themselves to that physiological sensation, riding out the panic or anxiety that comes with it, with this new posture, that we can renegotiate our relationship with panic. Another one is hyperventilating for 30 seconds. So, like, purposeful breathing in, breathing out as fast as you can. It makes you very lightheaded. That's another one that you can do with clients. If you have a swivel chair, you can spin in a circle for, a minute, get really dizzy, ride that one out. Or, maybe fatigue is one for you. Maybe it's somatic symptoms and you don't like the way fatigue feels or muscle weakness feels. So you go do a wall sit in a squat position for 30 seconds to a minute. There's so many things that you can do with an interoceptive exposure. And the best thing I would say is try to identify what physiological sensation the client is most scared of, and then move towards that thing in a hierarchical way. So I want to try this. I'm going to do the hyperventilate one just for like 10 seconds. I'm not sure I'd be able to talk for a little while if I did it all the way with you, but I'm going to the hyperventilate option. So 30 seconds of is one you can try. You can run in place for 30 seconds. You can go do a wall sit. If you have a spinny chair, you can do a spinny chair. If you don't want to do any of this shit, you don't have to do it, right? Maybe this is something that is a personal scare point for you. So doing it during a presentation like this is just not worth it, meaningful, or it doesn't feel safe to you. please refrain then. We won't know. But if you're game, give it a shot. So I'm going to start out for 10 seconds with the hyperventilating just to get that one going. That doesn't require me to stand up. I'm being lazy, but you can pick your poison. And we're going to do it, and we're going to see what happens. You get the point. You keep going with it. Checking in with the chat a little bit now. Thanks for participation, y'all. Even if I'm not attending to all of them, I really love it. I think it keeps things flowing. Um, yeah, and can keep the Q&As rolling. Okay, that's been about a minute, so I don't know how many of y'all did some stuff or didn't. I can tell you that just in doing that 10-second hyperventilate exercise, I felt lightheaded for a second. I was like, ooh, it passed pretty quickly. Um, but I'm wondering what it was like for you. I'm wondering what your posture is like now, if any of those physical sensations are still with you. This is one where watching someone do this with a client over video can be quite helpful. So there are tons of ones on YouTube that you can look up. I suggest you do those in your own time. But again, the main focus is eliciting physical sensations, especially ones that the client is uniquely fearful of, and renegotiating your relationship with them, not letting them become a barrier between you living life on your own terms. Interoceptive exposure. Okay, so imaginal exposure. We're not going to do a full exercise for this one, but I just want to discuss what it's like because I think it's one of the easier ones to understand, even if you don't see somebody else doing it over a video or something like that. But an imaginal exposure is exactly what the title suggests, exposure through imagination. And it tends to be widely used for post-traumatic stress disorder, trauma more generally, a little bit in OCD as well. And the process involves some sort of exercise, similar to what we did with the picture, that is a bit of imaginal exposure, but maybe in a more trauma-aligned way, revisiting internally a traumatic memory, visualizing it, getting in touch with it. Noticing the physical sensations, the thoughts, the emotions that show up as you do that, and making space for them. This is a great one to do with clients impromptu and I'll be clear, not for trauma or PTSD. You want to be a lot more intentional about those, but for anxiety, even OCD, any client really that's working with you, thinking of ways you can bring the distress into the room, even if there's no physical manifestation of it, so that the distress can be with you and you can react to it in a new way. I do imaginal exposures with clients all of the time, and not in very formal ways either. They start talking about a difficult relationship they have, and I'm like, hey, tell me more about that. What does this relationship look like for you over time? Okay, this is a very specific confrontation. Walk me through how that went. And the reason I'm doing that is my hope is that by them imagining it, the emotions maybe that have been suppressed or avoided start to come to the surface. And then we can change our posture around them and hopefully move towards healing. So, imaginal exposures can be done on the fly. It's a lot of the work that I think behavioral therapists do often with their clients, even if they're not formally calling it that. How are we bringing these feelings into the room? How might we be better at bringing them into the room so that we can, at the very least, feel our way through them and maybe even better, feel our way through them and then have it identify some behavioral action we can take that might move us more in the direction of our personally identified values. Okay. All right, this is one we are going to do. Narrative exposure, it's got a similar vibe to imaginal exposure, but specifically involves a story, and can be helpful if you do a little bit of writing, or some form of storytelling. So maybe that involves the client telling you a story, or maybe it involves them writing down a detailed story. Obviously, we're not going to be very detailed as we do the practice, but that's what we're going to give a shot now. So again, I want you to take a moment to settle in. Maybe notice your feet on the floor. Notice how they're rooted to the floor. Take a breath. Now pull into your mind a past experience you have that still brings discomfort. Something difficult, maybe even painful, but also manageable. Something that's approachable for you right now. So in a moment, I want you to start writing a short narrative about this experience, maybe like a paragraph on your phone, on your computer, wherever is convenient. But I want to note that this isn't about crafting some perfect story, and it's not about fixing anything. It's about making contact with a part of your history you carry around with you. So get into your writing. And as you do so, imagine the scene opening up in your mind like the beginning of a story. See the setting around you, the surroundings, the season, the light, the details that place you in that moment. And continue writing those sentences. Where were you? What was happening? Write in simple, direct language. What happened? I know I'm going to distract some of y'all, but I'm going to keep with it. As you are writing, notice what shows up. See if you can get with that posture we've been talking about. See if you can lean into openness. Now bring your attention gently to the version of you in that story, that younger version of yourself. What did they need in that moment? what values were there for them to connect with that would have helped them move towards meaningful action. Now, I don't want you to change the story at all. This is something that already happened. Just acknowledge those values with compassion. Again, touch back in internally, notice what is there, notice what your posture is like. And I want you to finish by writing another 1 to 3 sentences about the person you want to be now in relation to this memory. Which values matter most to you as you face these kinds of experiences? How do these values guide the way you want to move forward from this moment? And not as an effort to beat yourself up about not being this way when it happened before, but as maybe a lighthouse in the fog that guides you towards how you would like to be in the future. Again, you're writing about who do you want to be now? And then when you're ready, you can stop writing, take another breath, and notice the space you created between yourself and this memory. You didn't create this space by avoiding it, but rather by meeting it directly with awareness, compassion, and in touch with your deepest values. So narrative exposure is, best for things like complex trauma, grief. It can be intertwined with any of the other disorders we used in an evidence-based way. There's some pretty good evidence around that. And it doesn't have to be just done this way, but this was one way of doing it where we were intimately connecting with values as we go. All right, I've got one last fun one for y'all. I think it's going to be fun. So my thought around this, so this is ERP, exposure and response prevention, um, gold standard for OCD. Hold on, I'm getting a couple of texts from the moderator. I want to make sure I'm not missing anything here. All right, cool. Just let me know about time. They said we've got 20 minutes left. Perfect. All right. So yeah, ERP, exposure and response prevention, gold standard for OCD treatment. My thought was, okay, I'm gonna make a bunch of therapists do an ERP virtually, but I don't know how many of these folks have OCD. So that's going to be tricky. Well, I guess there are ways to get in touch with the obsessiveness involved in OCD, even in small ways. So that was my hope with this one. So we are going to try to compassionately touch in with a small bit of what the experience would be like for someone engaging in ERP that was struggling with OCD in some form. That is my hope, and we're going to have a little fun with it. Maybe we're going to be a little bit irreverent with it. Hopefully, we're also going to be sensitive and gentle with it too. So, when we're doing ERP, just some background, essentially what we're doing is we're confronting anxiety triggers while refraining from rituals or compulsions, right? So the OCD cycle and, an intrusive thought shows up, which creates anxiety. I try to control anxiety with my compulsion. Okay. ERP, Let's not do the compulsion. Let's ride out the anxiety. Let's increase behavioral flexibility, even in the presence of distress, aligned with the inhibitory learning model. So, sounds simple, but discomfort is hard. So, let's play around with that a bit. So, here's the exercise that I'm going to ask you to do. Again, like interoceptive exposure, you don't have to do it. I won't know if you do it, but if you're game, let's give it a shot. And I'm gonna do it too. So, if you're willing, I don't know, you're at home, so maybe a number of you aren't wearing shoes. Maybe there's something else dirty in this room, in your room. You could touch. I didn't think about that doing this from home, but some of you are going to be wearing shoes, so we're going to stick with it. So if you're willing, I want you to place one hand on your shoe. And we're going to do this in a hierarchical way. So maybe it's the side of your shoe. Maybe it's the top of your shoe. Maybe it's the bottom of your shoe. Like really wipe it or hold it or tap it, whatever you're okay with. But like, yeah, t touch that germy thing. Do that now. All right, now, whew, bring your hand back into a natural resting position, however it was. Maybe it's in your lap. I don't know. And notice the immediate urge to, I don't know, maybe want to go wash it, wipe it, rub your fingers together, look at it. Oh man, what did I get on it? And notice any urges that might be there to get rid of this discomfort. And for the next 45 seconds, we're not washing or wiping or changing. We're just letting that sensation and urge exist. Notice any stories your mind jumps to. Like notice the thoughts. Mm. And again, I said I was going to do it with you, so I'm gonna do it real quick. I forgot to do that part, but I can't see, but I'm wiping the bottom of my foot, and I am wearing a shoe right now. It's cold, so I put them on. I'm wiping it. Touching in with my mind right now. I'm noticing my thoughts. Like my mind's like, you touched something dirty. What if this is unsafe? What if there's something infectious on the bottom of your shoe? What if I shouldn't have done that? And I want you to let those thoughts float by like subtitles in a show you're watching. Don't argue with them, just notice them. And shift your attention to your body. Notice the hum of discomfort, the heat in your fingers, the tension in your shoulders. Just observe it. And I want you to talk to yourself, inform yourself that I can feel this and choose not to respond. And then when you're ready, come back to us. You need to say, take a second to go wash your hands. No judgment here. We can't see you. Maybe there was something nasty on the bottom of your shoe. Just kidding. Yeah. Throw this into the chat. What was that like for y'all? Maybe another one of the exposures spoke to you a little bit more. Like I said, it's our last one that we're going to do. What were some of the other ones like for you? Were there any that stuck out? Were there any that were super uncomfortable? Just a quick toss in to the chat. So some other exposure approaches that we didn't cover today. We hit on prolonged exposure just briefly. I mentioned it. But just some discussion about that because that's a common technique in trauma work. Prolonged exposure is an evidence-based approach for PTSD that helps people gradually confront difficult or traumatic memories and avoided situations in a safe and systematic way. Like I said, it typically involves some combination of imaginal exposure and in vivo exposure, as well as processing or even like cognitive reappraisal to reduce fear avoidance and trauma-related beliefs. I wanted to tell a little bit more about that other approach because it is a very common one that people use, even though we didn't cover it today. Some other emerging techniques, VR exposure, which I think could be pretty. I haven't used it myself with my clients just because I don't have the any apparatus that would allow for it, but I think it could be really interesting, really cool, and really expand what we're able to do in the kind of context we tend to see clients in. So pretty interesting. We mentioned behavioral activation earlier on, discussed it well, so we covered that, and there are a few more. Um, yeah. All right. I want to cover this one slide and make sure we pretty in depth with it. And then I want to shift more towards like a question component to make sure we make space for that, even if I miss something on the back end, because I feel like we've covered some of the more important pieces. But some ideas for if you start to incorporate these techniques on your own that I think are pretty important. So co-creating hierarchies. So I think it's important to collaboratively develop your hierarchy with your client and base it around their values. That's very important. Uh, be flexible, be variable, be unpredictable with the exposures you use. And in that way, we're not going to be reliant purely on habituation. Mix it up, move towards distress tolerance, acceptance, and willingness rather than this idea that what we are aimed at doing is just solely decreasing distress. Monitor behavioral avoidance that's coming up in session and between. Internal avoidance as well, and values inconsistent behaviors. Some of the best ways to do that are, like I said, with those discussions around posture and continued discussions around values. Debrief deliberately. Ask the clients what happened, what was learned, how did this move you towards your values? Okay, what's the next step? What do you want to do next? What do you want to risk next in the sake of your values? And in doing that, normalize discomfort, emphasize willingness and acceptance rather than avoidance. Emphasize moving towards what matters rather than simply telling them that they need to be less avoidant. Okay. So this was a case vignette. We're not going to go into that, but I do because I think we've covered other stuff pretty well. I want to talk about this 90% rule. I mentioned it earlier. Hopefully it's popping back up into your head. But another piece of moving backwards in these tips when you're creating exposures with clients, especially ones that they're going to do when you're not around. I use this 90% rule that I got from, one of my supervisors, who is a major behaviorist. And it's this idea that when you are co-creating an exposure and getting buy-in from the client, you ask them the question, okay, this is the thing you want to do. Is there a 90% chance that you'll actually do this thing? If they say no, it's less than that, then compassionately, you say, okay, well, maybe that thing is just a little too big right now. Let's change it so that it is 90%. And I've found that if you can keep doing lots of 90% exposures, you find yourself building up slowly over time in a very consistent and sustainable way. So it can be a way to increase buy-in as well as a way to increase motivation and really pick exposures that the clients are actually going to do. So that's a rule that or a tip that I would highlight that you can, toss in there. Ask the client, is there a 90% chance you're actually going to do this thing? If it's less, then pick something more manageable and just build up lots of 90% efforts. All right, I'm turning back towards the chat now. I think we started about 5 minutes past 9, so we have about 11 minutes left. And I want to make sure we are getting to what is showing up on here. Okay, I see a lot of good things in the chat. I've noticed those. Some kind words as well. I appreciate that. I want to turn towards the Q&A. Make sure I've answered some of these questions. Okay. All right. So this question, I actually haven't used any exposure therapy with my clients yet, but I'm really interested because I work with Spanish-speaking populations primarily with extensive trauma, and I think some would benefit greatly from this. However, I'm struggling on how to get started. Any advice on how to introduce this in a culturally adaptive way would be greatly appreciated. I think that is a wonderful question. It's another slide that I have a little bit further down the piece, but I'll discuss it now because I think it's so important. That is one of the other reasons why I love values discussions so much, is that we can be very helpful cross-culturally and still do exposure work because we're basing it around on what is personally meaningful and important to the client. So, like I said, much exposure or like rigid exposure work involves some sort of fear ladder or hierarchy that you build, and may have some preconceived notion of what that should be. If you base it around values instead, you get to let the client dictate how that goes. So I think, maybe that feels like a cop out, but it really is not. I think values can be one of the most important things to make this applicable for clients from any background. So that would be the number one thing I would highlight there. The next question, one of the most difficult things for me is convincing the client about the efficacy of exposure. They want a magical recipe. I use the body sensation of anxiety a lot. Yes, yeah, absolutely. I think there's plenty of data out there that, AI, ChatGPT has made it much easier to uh, get ideas about research supported moves than ever before. So maybe you can point your clients towards that. But there's tons of research out there about the efficacy as well as the effectiveness of exposure work. It shouldn't be something that you have to sell in that way. And then, if we're being more informal about it, again, another reason why I love values, because you can really point them in the direction of why this is going to be helpful in their lives. You don't have to convince them of it. They learn it for themselves. Okay. Thanks for the questions, y'all. One of the challenges I face is balancing skills and distress tolerance while also not reinforcing avoidance. Absolutely. Yeah. Again, posture. Yeah, posture conversations over and over. Exposures aren't the end of the game. Maybe they're the beginning of the game, and they can just further highlight skills deficits for us. We have them do an exposure, something shows up, we learn a little bit more about where they're at really and how they're able to navigate with the skills that they have. So you don't like do front load all the skills, they're good on the skills, and then do exposures. You get them good enough with the skills, you start doing manageable exposures, and then you really learn where they're at. That's a really exciting piece of why exposure work to me is so interesting. All right, I'm gonna do one more, and then I'm gonna turn back towards the presentation just to be mindful of time. Um, um, Yeah, I like this one. So, in regards to navigating the anxiety during exposures, any recommendations? Obviously, the language here isn't completely about reduction of anxiety and is more about acting when it's hard. Though I'm assuming you also maybe help them move through it in specific ways. So, the question being, um, navigating anxiety during exposures, any recommendations? Yeah, I mean, I'm going to come at it from an act lens, but like if we do an exposure and anxiety is not present, like damn, that's not good. And I don't mean like not good, like maybe that indicates to us that we need to just do something different. It's good information, but exposure is inherently uncomfortable. And we want to be just uncomfortable enough. We don't want to be so uncomfortable that the posture gets bad. But we want to be uncomfortable so that behavioral flexibility can kick in so that we increase our ability to persist even when things are uncomfortable. So yeah, uh like sometimes I've heard other ACT therapists say when someone talks about how uncomfortable they are, their reaction is like, "Oh, cool." And it's like, "Well, that's weird." That feels invalidating, but that's not the point. The point is that like we're learning how to react to discomfort in a new way. And what we're really interested in is, are you moving in the direction you want to move in, regardless of how intense your discomfort is or not? So, yeah. And like I said, if there was a way to reliably reduce anxiety um, through psychotherapy, like time and time again, and it just kind of stayed there, that would be the thing that I would focus on. But the data suggests that it's just a lot more complicated than that. And living meaningfully is ultimately what they want to do anyways. So, how do we get them better at that? That's a lot more important to me than whether they do or do not have, present distress. All right, I'm going to turn back towards the presentation. Thanks for those awesome questions. If you have more, toss them in. Can't guarantee we'll get to them, but I want to make sure we get through all the educational components that are really musts for me to impart. Um, we have covered all of this stuff already. This related to the question about working across difference that we had from during one of the Q&As. How do we make this stuff useful and helpful for everyone, rather than just what has been most well researched with, rather than the individuals has just been most well researched with. And I think we don't have enough good evidence out there yet to really support this claim I'm about to make in evidence. Uh, but I think what can make it most helpful is the values component. You let them guide it. Explore what is meaningful to them, explore cultural values that are most meaningful to them, explore personal values that are most meaningful to them, and then let that guide the exposure work that you do. And like I said, the evidence base is lacking there. So what a wonderful area for researchers, for folks who like doing that work to start exploring more of, is how much can values work improve outcomes when we're using exposure across difference. Okay. Yeah, so the future directions and gaps, I think the one that speaks most directly to my soul is the one I just mentioned there. How do we make this more cross-culturally relevant, relevant for people of all backgrounds and identities? We could just say that it is because, of the research we've already done, but we know that most of that research has been done predominantly with people from more homogenous cultural background. So we need to expand that, and we need to explore, does values exploration supplement that even more? Um, yeah. Last thing I want to hit. So in our last 2 minutes, just to plow through it, some conclusions and take-home messages. So exposure is powerful and can be very flexible if you are open to it. Values integration increases meaning and engagement with exposure work. This work is relevant and fits into many different theoretical orientations. So even though I probably overwhelmed you today with one theoretical orientation around how to do exposure, mix and match it with your own, and I think you're going to find that there's a ton more overlap than there is discrepancy. But what I'd like to impart is to reframe exposures as valued living rather than simply symptom control. And in continuation of that, some of the things that, like, if you didn't remember anything from this lecture, but I wanted you to remember this, it's posture. Continue to discuss posture with your clients and make it aligned with your own theoretical orientation. But especially when you're doing exposure work, be aware of the skills that they either are or are not demonstrating when the distress that is causing the dysfunction is present with them. There's no better time for a skills assessment than, in the heat of distress. That is one of the best tools that I think exposure lends itself towards. So not only use it for the rigid reason it was naturally created, exposure, but also use it as a skills assessment. Remember the 90% rule. Really, that just means make sure you are creating manageable and realistic exposures for folks. Um, Yeah, I mentioned this before, but make it about movement towards values and bravery. That matters more than decreasing somebody's suds because distress is sneaky and unpredictable. Flexible behavior, inhibitory learning is more important than habituation. And I'm not just saying that. Our research indicates that pretty strongly. So those are big take homes that I hope you take with you. So the last bit was just questions that I had. If we ran out of time, something I do need to cover is that portions of this presentation were developed with the assistance of AI. I've been pretty hesitant to use AI, but as I've woven them into my presentations more and teaching opportunities, it is an incredible tool. So yeah, this presentation was created with some of that help, and I highly recommend that you use it for help in your own presentations if you haven't explored that already. There's no commercial support to be aware of, as well as no conflicts of interest here. Yeah, some of the references in case I want to thank everybody so much for coming out to this event. I hope that you learned something from it. I hope that it wasn't too redundant. I know that exposure is something we talk to death in clinical psychology, so I hope there was something new and interesting to you. And I really appreciate your time. This was my first time doing a CE event, and it was a lot of fun. So thank you very much, and I hope y'all have a good rest of your day.